Tonight, the first curfews begin in Germany, with more on the way as cases soar. The UK will close all recreational establishments almost immediately. Hello and welcome to another episode of CoronaBeat on Force 13 Live. This is March the 20th, and again we have another day of, well, we start to wonder where the days will end of all of this outbreak. Not anytime soon, I can tell you that much, as the cases continue to increase in some places by quite a large margin, especially in the US in the last few days, where cases have been rising very quickly, and I'm sure a lot of people are familiar with that. Today already, over 4,000 cases, just looking at my screen here, and nearly 5,000 actually today, and of course those numbers coming in all day long. Italy, nearly 6,000 new cases today. That's the largest rise so far. The rate of increase in the new cases per day is decreasing, but at the moment Italy's still posting new highs every day virtually in case numbers. My name's Nathan Foy. I'm joined by the team as always here live. Well, not there, they're somewhere. We'll look at a black screen for a little while then. But you'll be able to hear them briefly. We're joined by Strat, David, Isaac, and Gidrius. I don't think I missed out anyone, did I?
Don't think so today.
All right, good. There they are, all showing us different things. And Parker's there showing the world map right now, and you can see that 250,000 total cases, Parker.
Yep.
I think actually we're over that now too, which is kind of crazy to think of. Up by 20,000.
20,000 today, is that?
I think we're over 27,000 today at this point.
All right. Well, the main headlines that you saw at the start there: Germany, a curfew coming into effect in the state of Bavaria now, which I think is where the epidemic started in that particular nation, and they're considering whether to expand such a lockdown effectively nationwide. Of course, we know what's going on in Italy. Recently, the army was drafted into one or two places because there were too many bodies, to put it bluntly, to take away. Now, in Italy so far, over 4,000 dead, 627 today. But let's start furthest forward on the time zones on the east coast of Australia. David, you're live streaming with us tonight on our Facebook page. What's the latest in Australia?
The latest news is that it continues to worsen. Channel 7 News on their morning show is now reporting that subject to the virus breaking out in clusters, local suburbs will be shut down. The Prime Minister will give another media interview on Sunday, but the number of cases continues to increase. We had a Reading and the...
Yes, we've heard about this internationally as well. Tell us about it.
The couple got married, and they were embracing, hugging the guests, and sadly, both of them were overseas when the news broke. 37 that attended the wedding have contracted it, but as I said, the picture is worsening. And Qantas it continues to bring Australians home. There is a concern that many are going to be stranded. There is a figure of about 1 million still overseas, but all flights into Australia are now unable to, other than Qantas.
All right, let's move over to Europe. Gidrius joins us again tonight over there in Lithuania. Did you have some news for us?
Well, I think confirmed 15 new cases of coronavirus today, which brings our total case count to 63. So far, still only one recovery in total. And today, 3 medical workers were confirmed to have the coronavirus, including 2 from my town, actually, which is kind of concerning. But anyways, moving on to another topics. Lithuania bought 2 million respirators and 6 million medical masks from China, which I think is probably the highest amount of those things we will ever have in our country. And a couple of hospitals with confirmed coronavirus having medical personnel are going to close. And so far that's it. I will stay updated on our news stream.
All right, thank you for that. And if you're elsewhere across Europe and you've got an update for us, please send them in, because on our team we've only got a handful of people, so we're intrigued to hear more. Cases rising in a lot of those countries as well, by the way. Quite a few of them over 1,000. Austria hasn't ever really been mentioned. They've got 2,388 cases now, which is not too far behind the Netherlands, which just reached 3,000 today too. Belgium at 2,257. France showing there that number appears to be very low. Only saying 1,000 there. I'm sure it's a lot more than that.
That's definitely a glitch.
Definitely a glitch. In Spain, 20,410. Just try and get a number on France there.
France is about 12,600.
All right. Yeah. So there we are with that as well. The Middle East also, a lot of cases there, really. A few places. Well, I think it's just Iran that's over 1,000, but Israel now 705. Qatar 470, Pakistan 501, those numbers rising, and very slowly across Africa too today. A few more places getting infections. Let's talk to someone that we haven't seen on any of our CoronaBeat streams yet. Isaac's with us, joining us from Texas. How are things going there?
Well, over in my neck of the woods so far, knock on wood, there have been no confirmed cases of coronavirus in my city. However, in Texas alone, so far, there's 223 cases and there's 4 deaths in the state of Texas alone. And the governor yesterday evening issued a executive order, I believe it was, and pretty much what that means for Texas was that no gatherings of more than 10 people are allowed from this point till April 3rd. And the restaurants, you cannot go inside restaurants and order food. You have to either order it via the drive-through or online. You can't sit at all in the restaurants and order from there.
That's almost a universal rule now. You're showing us some pictures as well.
Yeah, I went over to Walmart today, and they had 3 huge cases of toilet paper, and you could see this woman here rushing to get out of the area to get the toilet paper and make sure she gets it. They had one of each. They had one big thing of toilet paper and had one thing of paper towels right there. And if you look closely behind her, you can see the big stack of toilet paper that they had, maybe clearly a little bit there. And if you look over on my other image here, they had no milk at all. Like, most of their shelves were empty. This would be full a year ago. These would all be full. This is the bread aisle. There's no bread at all to be seen.
Is that on your other image? I don't think we've got that at the minute.
Nope, we don't.
But we get the picture that it's another situation in another location of stores and people buying like there's no tomorrow.
Exactly. There's a lot of people. There's a big line that stretched. They had to stretch it around 4 aisles to make it fit in the store, and they limited people one toilet paper. One toilet paper package and one paper towel package per customer or per cart, and it was going pretty smooth. And I imagine at this point now they probably run out of supplies at this point. And that was about 3 hours ago.
Let's talk to Samuel. You're in Chicago. You have some news for us today?
Yes, and some pretty big news at that. So the state of Illinois has finally issued a statewide stay-at-home order. So that means that all non-essential businesses are going to close. Obviously, essential businesses will stay open. And aside from that, nothing here is really going to change that much. It's just being made official at this point. But the bad news is we have 163 new cases in the state, as well as one additional death. So now we have five deaths in this across the state of Illinois.
And somewhere around 500 cases as well.
Yes.
The worst place by some distance now in the US, it would seem, is New York State, though, with over 7,000 cases. Strat, what's the latest on the ground nearby? Is he there? Oh,
Yeah, I'm here.
Nathan,
It's definitely been a struggle.
David, did you have something
for
there?
people around.
I'm sorry, Strat.
sorry, Strad, I've just cited 877 cases in Australia.
Yeah, that number's been bumped up. We were wondering what that number was a little while ago.
Considerably. Yep, so sorry for that, but it was 750 yesterday, so 877.
Strat, over to you.
Yep. So New York is the epicenter for the United States at this point in time, really, at least in terms of the concentration of the highest amount of cases. Of course, Seattle's where the first case occurred, but the state of New York has about just under half the total cases in the whole country. 8,305 is the latest count.
Is it?
Yep. Another 2,938 today so far. So almost doubling today alone. That prompted the governor of New York to order a statewide closure of all non-essential businesses, and that every even essential business that can work online should be working online at this point in time. And they're going to try to keep mass transit open for emergency needs over just regular transit. Things are really kind of getting out of control here pretty quick, especially because tests are still pretty low. The state of New York has done only around a bit under 30,000 tests at this point in time, yet already have over 8,300 confirmed cases, which compared to other countries that have been able to implement more widespread testing would indicate a potentially much higher total case count, which is very concerning to say the least for the coming days. We weren't the first state to really do more of a lockdown. We saw the San Francisco Bay Area do it 3 days ago. California announced theirs last night, and then New York jumped on the bandwagon this morning before Illinois followed it up just a little over an hour ago. But it's actually trickling over into side states in terms of the impacts that other local authorities are having to do. Connecticut is having to order a closure of all non-essential businesses at this point in time as well.
Is it also true that there's a stay-at-home emergency in Puerto Rico, Strat?
I am not aware of that at this point in time. It could be a possibility. Yesterday they were requesting the FAA to limit the amount of flights being sent to Puerto Rico. So they were trying to take preventative measures by stopping the amount of people that were able to even come from the United States into Puerto Rico.
Okay, well, that's another interesting strand there. Also, Parker, you're also here with your state as well.
Yes. So over the past good 24 hours, we've seen the soaring cases again. Over the past few days, we've had over confirmed 40 cases now, and we just recorded our third death today. It was they didn't disclose the gender, but it was a person in their 60s that was hospitalized before they had died. So that's pretty concerning. A lot of the counties in my Grant County had its first confirmed case today. So we will probably be on lockdown for a good while now. The cases are starting to come up here in the north and starting to spread rapidly. So we could be seeing a statewide lockdown very soon, especially with the way Marion County, the state capital, going right now. So we could be seeing a state lockdown in the near future as well.
Yeah. So just to reiterate, the places that have had the largest number of new cases today, I think it's worth reading out. Italy, just short of 6,000, 5,986. The US currently at 4,948 at least. Germany 4,528, Spain 2,335, France 1,617, Iran 1,237, and Switzerland 1,185. That one's going a bit under the radar too. It's really bad over there in Switzerland, with one of the highest case ratios in the larger countries, or at least the countries that aren't extremely small. What do we think of that?
It's interesting. I feel like it kind of has to do with the chunk with its proximity to Italy.
Yeah,
Probably
and
the main
northern Italy in
contributor to that.
particular.
Yeah, I presume that most of the cases are either going to be in the capital region of Italy or along the southern part of the country. I don't have exact geographic figures, but that's just the general assumption you'd make.
Well, no, it's
Uh,
generally in the north. I mean, there's a few major
Surely north.
cities in Italy, but around the Milan area, high
I meant
populations.
I meant in the country of Switzerland, not Italy itself.
Oh, sorry. I don't know what I was
Yeah.
talking. Okay, I was still talking about Italy there. I should point out
No,
that
I was talking about
there is a
I was talking
little
about
bit. There's quite a few more cases also in Rome too.
yeah.
As for Switzerland, I've not seen no. But yeah, I
It's
get your point.
Switzerland. They were kind of leveled, after a first big day of cases of kind of having just a couple hundred come in a day, and just the past 2 days now, they've kind of seen a larger uptick in cases. Of this is their second straight day of having over 1,000 daily cases reported, which kind of it brings me to another point. Right next to Switzerland in terms of confirmed case count today, right above them is Iran, which has seen, at least in reports, almost a flat plateau for the most point if you were to
Yes,
try
that's
to draw
been
an
going on
average
for a
line out of
while.
cases
Makes you
over the
wonder what's
past several
going on
days.
there, because as far as I can see, Strat, Iran has apart from China, the largest amount of recoveries.
There's a lot of worry over the potential accuracy of Iran's reporting data.
I know there is
Um,
that big caveat, but
I was gonna say
still an
that, but
interesting number.
basically they've been hovering between like 900 and like 1,400 cases a day, very consistently for the most part, for well over a week now, which is not really something that you would have just expected. They've kind of seen more of a just direct linear increase after their first spike compared to other places that are much more exponential, such as the United States or
And from
Germany
what
or
we hear
Spain.
in Iran, Strat, is that people are flouting the the state.
They're kind of moving towards more protectionist acts to try to prevent further spread in their country, based on the data that we have, at least at this point in time.
All right then. Where do we go next? Anyone else with anything for us right now?
Actually, I do want to add to what
Sure.
I was talking about earlier, and this is more so discussing, kind of discussing public transportation. I found out earlier today that the commuter rail system in Chicago Metro is actually cutting their weekday service in half. They will not be however, they won't be making any changes to their weekend service, but clearly this is due to the decrease in ridership because of all the quarantine and everything that's been going on. But the Chicago Transit Authority is still running regular service, as is the same with pretty much most, if not all, of New York City's Metropolitan Transportation Authority as well. They are running fully normal service, including both their subways and railroads.
And among the many things being cut back here in the UK as well is public transport, also going on here in most of our cities, really. Of course, schools have finished here now for the foreseeable future. Probably the current academic year is over. And also, of course, the big news today is that all what I would describe as recreational establishments are being shut down tonight. Again, for at least a month, whilst the situation continues to escalate. London, probably worse than anywhere else in the UK. You might say that was expected, but there is going to be a massive burden on health services in the London area pretty soon by the looks of things, and that one or two are concerned that it is going faster than expected. Also, what's been in the news here in the UK today is that key workers, people who are, involved in the health service and the emergency services, are struggling to, and people who work at supermarkets are struggling to get their shopping done because everyone else has been selfish and has nicked everything out of the stores, because people are still panic buying like there's no tomorrow, and certainly not being considerate for the people who are probably going to help them in a big way very soon.
Exactly.
At this point, I guess it's time to take a break. We'll have some more for you in a few minutes, but at the other side of this, we'll have the latest numbers from around the world. This is Force 13 Live, with more on the coronavirus after this. During this special coverage, we'd like to hear from you and the situation in your area. Send images, video, or audio recordings to contact@force13.com and we'll put them to air. with countries around the world trying to stop another tide, not just of the virus cases, but of the economic impacts, which are sure to be very large now at this point. The UK today as well outlining plans to try and keep the job losses down. I guess we'll throw it to Strat to talk about the latest economical information in the US and around the world too. What's the latest, Strat?
Latest information coming out today is just no direct statistics, but increasing concern about a potentially severe economic slowdown that could be ongoing. JP Morgan and Goldman Sachs, which are the biggest banks here, have revised their GDP forecast for Q2 of this upcoming year to over minus 10%, which is worse than any quarter during the Great Recession back in 2008. So they're looking at April in particular could be absolutely brutal. We did talk
it
a bit
totally
about
is. No one's going to be doing anything in April by the looks of things.
No, and we did bring up a bit of the unemployment statistics yesterday of potential numbers. But to give them perspective, a little more data came out last night. Nothing too much more today. But for the state of Ohio alone, the first half of this week, so Saturday through Thursday, so tomorrow and Saturday for the count, had 150,000 plus people apply for unemployment benefits. The max, or the nationwide number for last week, which started to show a spike, was 281,000. So one state, which isn't even the largest state around, although Ohio does have a pretty good population, is almost as high as the entire country was last week. New York's getting 250,000 logins a day onto their unemployment site at this point in time. There's a direct link to potential numbers because people can log in more than once. But next Thursday at 8:30 a.m. is when some information may come out, and I have just the general into the stock market here. We were pretty flat most of the day for the markets in America, at least. There wasn't any good news, there wasn't any terrible news, basically, which is why things didn't really fall further. Although this drop off here late in the morning was when Andrew Cuomo did announce the incoming shutdown of New York. But we really kind of just slid late in the day as it felt like more bad news was going to come out late in the day, which, at least if you're talking economically, has happened with Illinois and Connecticut shut down as well. And just, people really probably aren't wanting to hold through the weekend right now in scenarios like this, with just the very high levels of volatility in the markets. It's a dangerous time, and this actually was the worst week for the market since 2008 as well. The Dow Jones Industrial lost over 17% of its value this week, which was pretty ugly to see. A lot of it happened on Monday, but a lot of inconsistency and choppiness through the rest of this week. And there's major concerns now that oil isn't bouncing back as well. That's going to just compound the impacts of what's likely to be a very severe economic downturn in places that are already going to be adversely impacted.
Now, of course, back to the cases, we've been watching them very closely. Do we get what we've started to see, some news outlets and people speculating that the cases in younger people are being underestimated as well? Is this true?
It's hard to say exactly, but at least in the United States, it is a probability that this is true, primarily due to our lack of testing. In America, most of the guidelines, because we're still rationing tests for the most part, is that you have to be showing symptoms to be able to get a test. But as we know, a lot of young people don't show any symptoms, or if they are, it's so minimal that they may not even notice that they may have the disease in the first place.
And again, as far as preliminary research shows, it could be as much as 50% who don't show symptoms.
Yeah, and just a case in point, and how severe underreporting may end up being is that in South Korea, where they implemented mass testing very early on, they had done thousands of tests before they even had their first confirmed case. The largest single age demographic of people infected was 20 to 29-year-olds, and that was 30% of the total infections in Korea, just about. It was slightly below 30%. In America, that number's around 5%, but that could easily be due to us just not really testing people. As we see mass testing roll out, which has
There's
still
so
been
many gray
egregiously
areas.
slow, we could see a significant increase. And not only are we dealing with test shortages, but we're also dealing with significant medical supply shortages as well. And a lot of companies, a lot of even small companies, are actually coming into play by repurposing their own production towards either medical gear
Yes,
or
they
even
are.
hand sanitizer. A brewery in Delaware is actually repurposing
I
itself
saw about that one,
to
yeah.
produce hand sanitizer, because hand sanitizer has to be at least 60% alcohol. But I had a contact that runs a quilting business in Texas, and he's actually repurposing some of his production to personal protective gear for hospital workers during this time. So
Wow.
there's a lot of even just small people. It doesn't have to be big companies. New York State today actually asked for repurposing production from companies and said that they pay a premium for the supplies
Yeah.
as well. They actually implored people to reach out to them to seek funding to change their own production lines.
There's so many
Which
things
was
that businesses and a lot of small businesses are doing as well in this country as well, and here in the UK. We've seen bakeries making their produce frozen so that people can take it home to bake, obviously, and of course taxis, who are now they're changing how they operate and delivering food to those who are key workers or the vulnerable. So there's a lot of things that are going on. Of course, stores here. I don't know if they're doing that. Are they doing it in the US where now they have special allocated hours for the elderly or for those who have disabilities, usually early in the morning?
Yeah, some places are doing it so that people most at direct risk from severe ailments, if they were managed to come down with COVID-19, can be the first in line to get daily supplies.
And the numbers continue to rise. The US now, contrary to the number that you see on your screen, 18,769 cases. That's an increase of 4,980 today. 235 deaths in the US. That's an increase of 28 today. The worst places for death tolls today have been Italy, obviously, 627 new deaths, followed by Spain 261, Iran 149, and France at 78. Germany's death toll still remains relatively low at 68, despite having nearly 20,000 cases, and we still don't really know why, do we, Strat?
No, there's a couple of theories floating around, but there's no real concrete evidence as to why, other than maybe because they saw the outbreak starting to pour in Italy, combined with that, and them having Germany was also the country with the first real instance of significant community transmission in Europe. Or back in January, they had a case where one company from one person had about 16 people come down with it. That might have prompted them to take action to be better prepared in case it came back with a much harder force the second time around, which it certainly has.
And I guess a final point we should touch on here in our rather abbreviated live events now, because there isn't quite as much to talk about, is that the weather is changing a bit, and obviously summer's on the way. But first, over in Europe now, it's going to be interesting to see what happens, I think, because we've been hearing ideas about whether it's to do with temperature or whether it's to do with humidity or both or neither. Europe's going to have a bit of a cold wave, particularly in the worst affected areas. That's going to be from Sunday through till about Tuesday. So it'd be interesting to see whether that will affect numbers at all. What do you think?
It's interesting because some cases where there's some locations where there's an explosion of cases, like New York State, for example. I'm just drawing a comparison. It's still pretty chilly in comparison. Although we've also been above average in the area over the past several days. It's over 70 degrees in New York today, for example.
Wow.
But it is going to be interesting to see if temperature, humidity could play a role directly, and we're kind of going to get a first look at that with the cold snap coming over the weekend, early next week in Europe. But at the same time, we won't even be able to really tell for sure for several days after because of incubation periods for the virus as well. So, as much as we want to just see snap instant data, that's still not going to happen.
so it's going to be another wait on that one, and just like, well, the whole world coming to a screeching halt, we're all on hold, aren't we?
Yeah, and I think it is important to highlight how quickly things are growing at a daily pace here, especially when we're looking at the death toll. If a week ago we were gonna, or not even barely a week ago, even maybe even just say 10 days, if we were gonna say that there was going to be over 600 deaths in one day in a single country, it would have seemed ridiculous considering the worst at the time in China when it peaked out was around, I think they didn't even pass a day of 300. But something important to note if you're going to try to track the potential lethality is that right now today's death so far is over 1,300. The peak daily death rate for the swine flu back in late 2009, 2010 was about 2,000. So we're on pace to pass that daily death rate very shortly, and flattening the curve just shows how important that is. Because
Wasn't
as we
swine
really
flu a much more gradual curve, though?
it was, well, at least in deaths, because its mortality rate was so low. It was
Of
about
course.
like 0.02% or something ridiculously low. It just managed to infect an obscene amount of people. Um, while we're dealing with
Yep.
something here that could be potentially much more deadly, we still unfortunately don't have a total accurate number for what the mortality rate could be, just because we're still relatively early into this. We're only a couple months in, and there's many different statistics that you can use to make your own estimate as well. You can use what the U.S. government, who are estimating could be an end rate of around 2%. You can use the total case
Yeah.
mortality rate, which is like over 4%, or you could use the rolling total of closed cases, which unfortunately right now, out of cases that have a recovery or death, that tolls over 10%. For
Yeah,
percentage
but
that
I don't know about
has
that,
made it.
Strat. At least
I
here in
don't
the
think that's going to get
UK,
anything.
people are only being tested when they're already hospitalized.
Yeah, and that's the problem. You're going to
And when
see,
you're
if you
hospitalized,
take a
you've got a
look.
much higher chance of dying than if
Oh,
you're not.
absolutely. Yeah. Thing is, if you look at the curve, until we saw a huge surge in international cases, that was actually declining pretty steadily. It had hit below 6% actually. As we see more people, recover over time, because compared to all the contractions right
We'll never know
now,
the actual
very vast
numbers.
majority will still recover.
We
The
need to
best
move on,
like an
Strat.
Hafner estimates.
What was I going to do next? Oh, yes, there was a comment that came, an interesting comment from Kayla, who says, I'm a nurse in West Virginia and we don't even have the equipment we need to protect ourselves. It was the last state to report, so we're having a harder time getting the equipment. What do you think of that?
I mean, I think it's just an unfortunate truth of the current situation in America. Our hospital system was caught completely flat-footed, um, which is a shame considering we had months prior notice, and the federal government had gone through potential role play scenarios back a couple of years ago, highlighting that this could be a potential problem running out of supplies early on. It's very unfortunate that we have hospitals having to try to make and produce their own masks and PPE because they don't
So,
have enough supplies already stockpiled, and it feeds into actually a developing scandal in Washington right now after last night reports came out that a senator knew about the potential situation after a private briefing. He's one of the members of the Elite Eight, which are congressional members that get the most confidential information. He's the head of the Senate Intelligence Committee, and then use that information potentially to sell up to over $1.5 million in stock, while saying that we were well prepared for the situation at the same time. So
yeah,
the
that is
developing
interesting.
scandals in America, not only on preparedness and economically, but we're also seeing political scandals come out of this as well at this point in
Well,
time.
let's not get too much into the politics side of all this. We try and stay away from that as much as possible on our coverage.
I mean, it just creates a problem
I
with
know.
trust with the government
Yeah,
situation.
I know. But we sort of try to avoid that because our credibility and all that. But before we finish up tonight's show, any other comments from the team?
Well,
Nope.
I just have. I mean, all I have is just more pictures, and then I have a map, and that's about it. So
Yeah,
Yeah.
there's a map right now. That's
Yeah. while
another
looking through,
depiction of what's going on in the US.
while looking through all, it's just important to emphasize again the importance of, your own social distancing and thinking of not just yourself, but your family, your friends, and the community around you in these times. Because like some spring breakers, a couple people may think that if they get it, it's no big deal, they'll be fine. But that person could be the one transmitting it to more vulnerable populations, especially if you're in a state or location that has stay put orders at this point in time, such as what's going to probably end up being happening imminently for New York, Connecticut, Illinois, what
All right.
started in California, to heed the instructions. They're meant for your safety and the safety of your own friends and loved ones.
All right, David, a final word?
The New Zealand Prime Minister at midday local time is to provide a update on what's going on over there. South Africa now has 202 cases, and I do not want to see, especially here in Australia, where we'll be confined to, we won't be able to drive on the roads, but we could have 28,000 cases in 15 days unless we see a slowing down. And as I've mentioned a few times now, we've got the school holidays coming up in just under 2 weeks. And we also have seen all budgets, state and federal budgets, pushed back to October. Qantas, as I said earlier, they're continuing with flights into Australia, but it is getting worse and it's scary.
So, more dangerous times ahead, unfortunately. That concludes another episode of our special coverage on Force 13 of CoronaBeat. Check us out on social media for more information and ways to interact with us. And if you have some interesting news, you could, of course, join our panel here, which were sort of a makeshift panel that we're just throwing together every night of who we can get. But we're always open to hearing from you out there as well, because there's a lot of stories locally that may be of interest. But that's all from us tonight. We'll be back again tomorrow with another episode, same time and place, 9 p.m. UTC, with another episode of CoronaBeat. Till then, we'll see you again soon. Good night.